that the role of the CIO has changed totally. You know, we were software developers and architects, and we could tell you what RAM to use based on its transactional speed. Do you think any of that matters anymore? The answer is no.
Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics. I was the CIO for a 23,000 person health system, and one of the biggest challenges was to remain current on the technology and the trends that were going on myself.
Think of artificial intelligence as a orchestra. Right now, machine learning, deep learning is getting a lot of attention, so I sort of equate that to the string section. And obviously there are many sections to the orchestra, so someday soon, hospitals, healthcare organizations are going to be able to have amazing music.
We are seeing instances of folks popping up, us included, where we're having a primary care physician set up with the dentist in the same office.
I would love to get to the space where eventually we're using voice recognition to do all of our navigation throughout the electronic health record.
When we worked at Microsoft, oftentimes, you'd have crazy deadlines. People would say, look, we're not saving anyone's life here. We can't say that anymore. And we love that. It's like we can save someone's life. We can prevent a complication or a readmission by catching it.
A lot of the feedback people are hearing about former Vice President's remarks is that he was remarkably pragmatic. And then the one that I'm most excited about, he notes that the Medicare Innovation Center, which was created by the Affordable Care Act, has the legal authority to experiment with new models to engage patients for purposes of getting better value care.
Hyper-consumerism driving everything to a digital experience, because if we don't make it easy for patients like ourselves to use healthcare on our smart devices, companies like Apple are starting to do it for us.
I think we're right on the cusp of a huge digital transformation. It'll be interesting to see how CIOs sort of address that. Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. This is episode, I don't even know what episode this is, 47, I believe. 47. Can you believe it?
Big 50.
Do you remember what episode you were on?
I was like number 4,
it
5?
It was a single digit number. It was pretty early. So you were on for the HIMSS week.
Yeah, it was a big week. Fun week, actually.
That was crazy. Well, I'll introduce you in a minute, but this week we're going to talk about Epic's move into dental, which is interesting. David Feinberg from Geisinger goes to Google, which is big news. CMS is now reimbursing remote patient monitoring. Wouldn't that have been nice when we were at St. Joe's if they had done that? We were trying to do so many things there, and it was just hard to get the funding. Well, now the reimbursement's coming from Medicare, so I think that's going to spur a lot of things happening out of the home. So it'll be interesting to talk about that. This podcast is brought to you by Health Lyrics. If you're moving to the cloud, check out healthlyrics.com and take advantage of our about 8 years of experience of moving healthcare to the cloud. So my name is Bill Russell, recovering healthcare CIO, consultant and writer, and who else am I?
Who are you?
I don't know who I am.
Big time.
I laugh now because everyone always introduces, I went to the Chime event on Tuesday. Didn't see you there, sorry. The Chime event, and as I go around, people go, oh, this is Bill Russell. You remember him. This is the former CIO.
The recovering.
The recovering,
CIO.
the former. It's like people always talk about who I used to be.
What are you now? You a journalist now?
Thanks for doing that. No, you're going to find I still have some thoughts on being a CIO. So I'll share some of those today. Today, obviously, returning guest, David Baker, now a CIO. But I knew you when you were I knew you when you were a consultant. Right?
Yes.
So you went consultant, director, VP, and then when you left St. Joe's, you became a CIO.
CIO, SVP and CIO.
That's like living the dream. I mean, what do you attribute that to?
Great, solid mentors who scrutinized every molecule of my work.
I was a little tough on you, but I'll tell you, I've told this story a couple times. The thing that impressed me. You're a consultant. I get named CIO. You're a consultant, and you're like trying to get on my calendar. I mean, you're like feisty to get on my calendar. You come into my office and you're like, what's the biggest problem you have? I guess the fact that I think the actual problem was the clinicians hated IT, right? And at a certain point, that's unsustainable. You can't do that. I'm like, well, the clinicians hate IT. You're like, I can solve that problem. And you started on that path, and it started with Easy Pass. Then it went to 20 back or 60 back.
Yeah,
60 back. I mean, you just did all sorts of things around the experience, around the internal user's experience with IT, and took us from a very low ranking to a very high ranking with
making IT personal.
Yeah. And when people ask me, how did David get from here to there? I say, anybody who walks into your office and says, give me your hardest problem, I'll figure out a way to solve it, that person's going to get your attention, especially if they start solving the problem. And so I always, I use that story to tell people, take a risk, figure out what the hardest problem is, and see if you can solve it.
No, I appreciate that. It's funny because I'm having some really cool conversations right now around a syllabus for some women in tech work that I'm just trying to help contribute to. Obviously, I'm not a woman in tech yet, and I just want to see how can I think what I can probably help folks with just through my own experience, as is some of that the personal branding in your career, and then when's the correct time to step up, put your head above the parapet, and go and find those hard problems that folks are scared to address.
Do you appreciate those people? I mean, so it's now role reversal, right? So I was the CIO and you were in the chair driving me nuts with, Bill, you got to get me more money. We could do more things. Look at what we could do. Does that happen to you now? Are you getting that kind of thing? Like your staff is as eager as you were?
All the time. It's actually, it's annoying when I find myself sympathizing with you back in the day, because I'm like, damn it, I did used to, I guess give you some grief. But no, I like it. It's about channeling that energy, right? You want that. I'd rather have someone in the office passionately fighting for something they believe in for the great good of the company, right. And talking through that and what it looks like than someone who's just sat back just going through the motions every day.
Yep, you want a group of people that are waking up every morning thinking about how do you make, in our case it was healthcare. In your case, it's healthcare, right? We've talked about this before. I mean, oral
technology, but it's. I mean, I find myself. I like to look at myself as retail healthcare, to be honest with you. But I mean, technology in general. But whatever industry you apply it to, how do you make lives of folks better within the business in terms of giving them back, I always say, minutes in their day. That's always been my big thing, and it still is. And that's applicable across multiple verticals.
Yeah, we used to always talk about, the 4 areas where you need to really think about experience and the people's experience. One is the clinician. The second is the consumer patient. And we sort of loop those together because every patient is really a consumer at some point. And then there's consumers that aren't even your patients yet, but you need to think about them. Then there's the system/payer side. I mean, there's a whole bunch of people that are your clients in that space. And then the other space, obviously, is just the population at large. How do you get people to think about, from a healthcare perspective, we were like, okay, 80% of the people, we're not going to see 80% of the people in the markets that we serve this year. They're healthy, they're whatever. How do we keep them in that sphere of health? And, and we were always thinking about those experiences.
There were, but in fairness to you, and I think something that I try and model and would try and pass on as well is making sure, and you did this, and I made sure I did this, but you have a seat at the business table. And it sounds cliche now because a lot of people repeat that, but what does it mean? It means you're not an order taker. You're not there just sending out technology upon request and then supporting something you're given. It means what are the business objectives, right, for the next, it'd be great if there was 5 years, 10 years, right? Fortunate there, but what are the business objectives in next year? What are you trying to do? Right. And how can IT help you on that journey in liberating some of those wishes and meeting some of those milestones? It's really important that you're discussing first and foremost at the business level and then translating at the technology level.
Well, thanks a lot for being on the show. Clearly I'm not dressed for the show. They won't pick this up on the podcast, but you were actually the most watched full episode of the podcast so far.
Really? Was the volume was a little bit scared? Maybe people just
the volume on you. I think I don't want to go down the normal jokes that I would tell about you and whatnot, but essentially, I guess your parents, all the people in Europe who saw you, they all, you have a huge European following.
Really, man, that's what it is, right? The massive island of London.
I have no idea.
The United Kingdom. No,
I really can't answer the question of why.
I can't anyway.
But it's almost double any other full episode of the podcast.
I think it's people think, if this stupid dude can get a job, anyone can. How did this?
let's figure out how he got into the role.
Exactly. How did this foreigner roll up and get a job?
You know what? I do know how you got the role, and I have talked to the people you report into since then. I've seen them at conferences, and they thank me for hiring you. And I'm like, we joke when we do a lot of self-effacing humor, but they really love the work that you're doing. So the work that you're doing made the news this week.
Yes, it did.
So this is a pretty big deal. So Pacific Dental is one of the top 2 or 3 dental practices or dental.
Come on, dental DSO. Dental Services Organization.
There you go. So you provide back office for all these dental practices across the country.
We support dental owners, in doing better dentistry. I like to say there's a whole support network behind the partnerships where we will help the office with absolutely everything, accounting, recruitment, finance, IT services, business coaching, essentially.
And it's thousands? Hundreds?
We're at 700 offices now.
700 offices.
And with some really impressive plans for growth next year. It's no secret, but barreling along towards the next 100.
Well, anyone who's followed the growth of Pacific Dental knows that every year's an aggressive growth.
It's actually true. They made the fortune 500 or 5,000 now, a record number of times. That 14, 16. I saw a badge on the magazine the other day. Yeah, it's fun. It's just super impressive, and the fun thing for me is working with a true privately held company with just this breakneck growth that's organic.
Yeah. So it's awesome. So you make the news because the big Epic announcement. You actually alluded to this when we talked way back in February. So It's been a long time coming. You've been thinking about this for a long time.
Yeah, a really long time. It's obviously not the sort of deal that you embark upon overnight, and there were lots and lots of conversations around making sure that it was a good fit on both sides.
Because they didn't have anything off the shelf. It's not like you could demo the software.
So you can, as you know, there's just a handful of customers, essentially. I think less than 400 that Epic work with. So you have to be of a substantial size, and the module that sits within Epic is essentially called Wisdom. That's the dental module, and it is actually it's live at multiple.
Okay, so you're not developing this from scratch. This is
not total scratch. I mean, we're obviously we're a Vanguard partner with Epic, true partnership, and we are building out a DSO ready version of Wisdom, let's say, like some improvements that will help an organization of our size be able to operate hopefully with real efficiencies and a great experience. But they are live in the country of Finland. Their National Health Service, I believe, have both medical and dental, and then there's a handful of other organizations using that foundational product currently.
So what's going to be the biggest benefit? So paint us the picture of whatever it is, a year from now, 2 years from now, when this is implemented in all 700 offices. Actually, if you want me to set the timeline, you know how I set timelines. so I'll let you go ahead and set your own timeline. But what is it? I'd be like, well, can we have it done in 6 months? And the answer is no, but because it's organizational change. There's an awful lot of things that have to go into place.
Yeah, more about the organizational change actually than the product. As you know, and with the consolidation when we did back in the day of Meditech going down from the 9 instances to the 3 was, looking back naively at the time when I was, fresh into healthcare, that looks relatively easy. It's the same piece of software. How difficult could it be? And boy, it's painful. So I got good grounding, I think, in understanding the pain that you inflict upon the poor clinicians. Major workflow upheavals and huge re-education, right? And it's a time suck, let's face it. So I think we've come a long way, practice management wise in general, and I don't think there's a lot of options in dental outside of a handful of key enterprise players. But still, the software is far from, I would say, an amazing integrated user experience.
But you're not going from paper to electronic. You're already electronic.
I like to think that we have a huge set of obviously dental data. I mean, our founding owner, really, I joke that he's the original CIO because that's how he started out. He put a practice management system in his father's dental office back in 92 or 4. So yeah, we've been digital since Office 1. That's I think that's what we've done extremely well. And the existing practice management system has seen us through really well. But it's it's an operational tool that was built a long time ago with probably the purpose of just getting off of paper. There's not good workflow.
So it's client server. It probably creates us all sorts of
100%. Yeah, and there's loads of questions obviously around. There's multiple views as we know on Epic for sure. But I think it's a really solid decision for us because we're able to build something out that is. Really meets DSO of our size, our needs, and at the same time, I mean, forward thinking, like you say, in terms of the integration opportunities.
So if I'm a CIO in a market, let's assume I'm a CIO in a market. I don't want to say. So would I contact Pacific Dental and say, hey, you're on Epic, we're on Epic, or even if I'm on something else, but would we start trading data? In terms of through an HIE or even directly? And
so it's a great question, right? We're not at the moment. So this is kind of where our mindset is. We're a platform company. Okay, so folks plug in. We help support through multiple channels and ultimately multiple technology channels. So the option at some point I refer to it all the time as imagine the dental health information exchange. That also plugs in and plays with the health information exchange, right? Imagine the correlation of data that we can draw from with regards to oral systemic health and those conditions that affect the whole body that are driven through the window of the body, which is the mouth.
Right. That's interesting because so Epic's also part of sharing data with Apple and their iPhone. Oh gosh.
Their
health record application. Which name is
neither? I'm going to pull my phone up in a minute.
But essentially, so we could see in the not too distant future, essentially information from Wisdom in there as well. So I could, as a patient, be looking at potentially messages from you, from my dental practice, and information on prescriptions and those kind of things.
Yeah, for us, it's truly exciting, and I don't think I've ever been more excited about liberating some of that data safely. But in terms of you as the patient can now see if you want to. I mean, let's think about Epic, right? Now approaching 70% of the US population, knowingly or unknowingly, are operating within some component of Epic on their medical journey, right? That's pretty outstanding in terms of that volume. So imagine now you as that Epic-based patient can begin to bring the full continuum in, right, of your healthcare information, the traditional PCP, and then your acute visit information as well, and a multitude of data around that. If you wanted to, like the imaging, the billing, possibly. I mean, more than a lot of folks are utilizing, right, leveraging. Now you add in that full dental journey as well, and you have the pharmaceutical. I mean, it's just you're never going to have the bigger view of your health information.
So last question, you're starting on the cloud, or are you going to build it out internally and host it?
Wouldn't you be disappointed with me if I said I was going to build it out and host it internally?
There are yes. I would. The answer to that is yes, but there are valid reasons, and a lot of them are financial. It's some people have said that the cloud model is still a little pricey from Epic. I know this will probably get back to Judy, and I apologize. I don't even know the pricing model. I've just heard this from some clients.
Pricing's relative, I guess, huh?
Well, if you're just starting out, you're not replacing, you're not moving. Some people already have it on site. They already have the equipment. It's already in a data center. They don't have to build anything new out. And then they look at the cloud pricing and they're like, well, why would I do that? I already have all this stuff.
Yeah.
Well, you would do it when that equipment becomes end of life and you have to do something.
Yes, but plus, as you know, forearmed with a ton of information around what it costs to build out the practice management infrastructure, architecture that sits on top of a huge VDI, usually, infrastructure. So forearmed with that, where it's really going to cost to build out to see us into the next 5 years of growth, these things start to normalize, I would say.
I'm also, you won't see this on camera, but I'm looking over your shoulder, seeing a map of all the locations you guys are in.
All right.
And you almost have to be in the cloud if you're going to be servicing that kind of geography.
Yeah, we're so distributed, right? That's important, especially from even a latency standpoint, if you like, that we're set up in a good distributed way across the country.
Well, let's hit the two other stories. So, we're seeing a little bit of a brain drain here. So David Feinberg, who I consider one of the really good thinkers within healthcare, one of those people that was out there. He's the CEO who said we want to eliminate the waiting room and all that it represents. And for a CEO to say that was a pretty big deal, because what it represents is that the physician's time is the most important thing, and we're going to queue people up and make it inconvenient for them because we want to queue up physicians' time. So this is a CEO saying, hey, you know what, we're going to eliminate that waiting room. Not necessarily because we don't value the physician's time, but we value our patient's time as well. He was bringing genomics into the primary care area, so really forward thinking. Toby Cosgrove, former CEO from Cleveland Clinic, is at Google as well. So David Feinberg is at Google now. Toby Cosgrove is at Google. Atul Gawande, we know, went to Amazon, Berkshire, JPM. It feels to me a little bit like this is signaling that they're looking at it going, hey, you know what? There's only so much I can do within a health system. Potentially this is what, I don't know. I don't know what's going on in their heads. I would love to interview any of those three. But potentially what they're looking at it going, I think I could have a bigger impact there. Either the reach is broader. I mean, if you look at a Google, you're talking about potentially world health, right?
Yeah,
you're talking about
huge.
A global reach. You're also talking about reaching people, when they're on the internet. And we all clearly we're in front of the internet a lot more times than we're in front of a physician or
telehealth thing. Is that real now?
Or actually, it's very real, and CMS is going to start reimbursing it, so that's also very real. So, so to a certain extent, I think these people, they're looking at it going, look, and we also know this, that most visits start with not telehealth; it starts with a Google search. Hey, I've got a sore on my foot. I've got, that's where most health starts. So if you're Feinberg and Cosgrove and they come to you and say, look, let us give you a little picture into what we have access to, I think anyone who's creative and whatnot is going to look at that and go, oh gosh, we could really impact global health, as opposed to, say, Cleveland Clinic, even though they're pretty broad, they're within a certain set of markets. And Geisinger's only really Pennsylvania and I think a little bit of Jersey, maybe some New York, but essentially that's the market they're in. And so they see this greater opportunity. Do you think we're going to see a lot of the innovation? I mean, now that you have these people going over there, do you think we're going to see these companies finally get really focused and really understand healthcare and how to apply these technologies?
So I think there's been an exodus of a lot of the leadership and just the traditional, especially acute model in general, right? I mean, it's been changing and morphing substantially over the years into into those smaller specialties that build around those acute centers essentially. And then, you know, the joke around telehealth, it is real, right? I mean, it's been there. I've used it, I'm sure you've used it, and we've deployed systems that we know, you know, the numbers are there now. So I guess the question, I feel that it could go one or two ways, because this is a hard industry to change in terms of just big healthcare, population health management, right? Big numbers. It's very set in its ways, even the thinking, which is why sometimes, you know, in all honesty, I stay away from some of the events and particular tracks, right? I mean, Dreamforce, for example, right? You go to some of the really cool executive tracks and stuff. I go hit the retail tracks a lot of the time. And if I'm really worried about, let's just say, security at a certain point in time and want to go deeper into a certain area, I'll go hit the finance tracks. Why? Because I'm going to areas retail. They're giving an amazing customer journey. It's about the experience, right? Finance, well, there's no one that cares more about the security of the information than some of those finance houses, right? So I guess my concern is, does healthcare just talk about thinking outside the box and doing things differently? Have we really moved far enough in the last 8 years that I've been at it? I would probably say no, in all honesty. Certain pockets have, certain companies you've seen move the mark a little bit, but it's only when I think these big changes in leadership happen that you'll see some changes for the better. With that said, Google, Amazon, I mean, I love some of the stuff I'm up to with them. It's great, and there are these little innovative pockets. But on the flip side, are they also too big to be as myopically focused in that area that they need to be?
Right. Yeah, they're still billion-dollar companies whose major source of revenue is advertising and those kinds of things. Google search and advertising is still I think it's like 90% of their revenue. I mean, it's a significant number. It's huge.
So this is they want to be disruptive, right? Where I think it's going, I guess to finish that point is, I'm pointing over there because there's an Orange County Business Journal somewhere. There's I can't remember the name of the clinic that opened up, but it's technology-based membership, primary care physician office essentially. No insurance. You go in, you pay your membership fee. It's funded by, I think, Benioff is one of the financiers. There's one that was up in San Fran, and one that just popped open down Fashion Island here. They're the folks that I think are pushing the boundaries, because they're saying, and you know, unfortunately there's a barrier to entry, right? There really is. But in terms of, are you interested in your care? Can you afford, you know, true private care? Come and pay us monthly fee, see us as much as you want. Do all of these amazing tests that you want to do, stuff that you're never going to get in the traditional healthcare system. That's the stuff that I really see pushing the boundaries, is folks who want to take health into their own hands and want to throw the cash at it.
Yeah, Jonathan Manis, former CIO for Sutter, I love listening to him talk, and he and I had a conversation recently. And one of the things he talked about at the Chime event, gosh, I think it was a year and a half ago, was that digital transformation is happening to healthcare. The good news is it's a 10-year journey. The bad news is we're 8 years in. And he said, and now all of a sudden, he said, you're going to see the disruption start to pick up. And he just rattles them off. He's like, look, this has happened, this happened. And as he goes through the list, he goes, what you'll notice is these people have come around the outside of the business and said, what's the high margin, low risk business? And they've said, we're going to take radiology, we're going to take surgery centers, we're going to take, and they just boom, they just knock them off. And until what's left at the provider side is high risk, low margin. Well, that's no way to run a business. It's all high risk, low margin. As the sisters used to say, no money, no mission. So if you don't have the money to invest and you've lost all your high margin business to subsidize the rest of the business, then you're facing a world of hurt. I'm trying to think what, Google's doing so. I think one of the things these guys will do is help them to focus. They're everywhere. I mean, they're like, hey, we're gonna store your medical record was a long time ago. Then it's, hey, we're gonna do contact lenses that can tell whether you have these diseases. And then obviously they're doing they're collecting all this medical information with this project they're doing now with artificial intelligence and whatnot. I think that's their space.
Yes. I was going to say.
It is the artificial intelligence. They're going to be able to make meaning of all this.
Yeah, because they've got, I mean, if you think about applying, what are you really good at? So here's the thing, both Amazon and Google, I've been really fortunate to work with some really great minds in both those places. A couple of weeks back, I was up doing a session at their briefing center up in the mothership, which is cool, Silicon Valley. It's really pretty amazing up there.
Are you allowed to talk about that, or do I have to cut this out of the show?
Yeah, you might have to cut it out. The lawyers will hit me. No, I'm not going to give away anything I shouldn't, other than the fact that I think there's a huge angle because of what they're good at, right, with regards to those volumes of data and the world's information, is then applying that machine learning and AI. And they've opened up their healthcare stack is open now, right? Their API library is there. It's ready to be tapped into. So utilizing that against your own data sets is, I think it's going to be an amazing leap forward for lots of folks that tap into that next year. It's there right now.
And that gets us, the last story here is just CMS is going to start some CPT codes around remote patient monitoring. They're going to start reimbursing. So dental, I'm not familiar with dental. So you know how complicated healthcare is. We have Medicare payments, we have, payers, providers, all, just a whole litany of things to figure out how we're going to get compensated. Do you guys have a lot less of that? I mean, is it a pretty closed system?
Yeah, it's complicated for sure. It's a lot less complicated than big medical for sure.
So you're not sitting around waiting for CMS to say, hey, we're going to start reimbursing remote patient monitoring. You guys might have an opportunity to be more innovative or move a little faster. We
are, but for us, it's a slightly different set of insurers sometimes, right? And we're still waiting for certain treatments to be paid on, for example, right? So telehealth, teledentistry is the perfect example. There's still a little way to go. There are, believe it or not, some really cool use cases for teledentistry that we're working on right now, but obviously the model has to work.
Do you have anything you would do remote patient monitoring with?
Remote patient monitoring.
Yeah, we have
maybe from a specialist standpoint, possibly. That's an interesting question. I mean, yeah, ours, there's no inpatient services, right? They're all folks come in and go.
It's just fascinating when we talk about dental. It just fascinates me. It's right alongside, but it grew up differently, so it has different.
It's the redheaded stepchild, unfortunately, right?
Yeah. It's really interesting. So so that's all the news. I didn't really prepare any questions. I could ask you a couple of questions. I mean, you have a big EHR implementation coming up, and how do you prepare for that? I mean, do you have? I mean, this is pretty new, but I mean, do you have like a team of, because you didn't have a team of people before that knows Epic, so you have to build all that from scratch.
We have. They've been really good in their partnership and helping facilitate that build out. So
so Epic will help you to.
They'll definitely help us, and we have a few select vendors that will also help us. But they've been very methodical in how we build those teams, because it's not just a deployment initiative. There's a big build out, right? So they've been a great partner, and quite frankly, I've been fortunate in having some amazing resource internally as well. And I see that my number one job is recruitment right now, Bill. So I'm out there, I'm pounding the streets as well, because I can't do this alone, and I really work hard at bringing in world-class resource.
So are you saying right now that you want as many vendors to call you as possible to help you?
No more vendor help. No, I love my vendors, right? Now there are a lot of staffing shops out there, let's say, right? So there's, in Orange County, there's lots of realtors I've noticed, and there seem to be lots of agencies that specialize in finding the right staff member. I believe that at this point in time, especially in places like Orange County, there's an amazing network. I'm part of like the Orange County Technology Professionals Group, part of several other organizations, even through like LinkedIn, where there's good dialogue. I'm always looking around. We're always looking for people, and I think that if we post a job here, I'll start internally with our recruitment side of the house. I'll pick that up and I'll ping it out, and I want known entities, people that are referenceable by great people I work with. There's no better candidate than and then a referenced candidate.
Right. Yeah. As my as I brought him in, as my friend Eric Herrincole used to say.
There you go.
Past performance is the best indicator of future
results. Good book. I have to have him back. How's he doing?
He's doing well. So he wrote that book, How to Hire A players, and I love that phrase. Past performance is the best indicator of future results, and it really is true. I mean, when you say, "Well, I've never done that before, but I can figure it out," I appreciate that, and I like people who say that. But I'd much rather have somebody who come in who goes, "Yeah, I've migrated 3 or 4 health systems to Epic Revenue Cycle or whatever, and I know the process." And the good news for you is you're not on the edge. I mean, there's, well, as you said, how many? Couple hundred Epic clients.
Yeah, I think we're on the edge in some of the aspirational build out we're doing in terms of the integrations. We're doing some really great integrations, but like you say, it's tried and tested, and the attractiveness of that product as well is just the amazing rev cycle and back office functionality that we'll be able to leverage out the gate to an extent.
That's awesome. Well, anything else you want to talk about? I mean, I don't have any other questions. So
was this? Did you have a pull out today? And you're like, can I plug Baker in? He'll come on the spot. Be honest now, Bill.
I am booked through the end of the year, and you know what happened? I kept looking at my calendar, thinking I was booked through the end of the year, and I looked down, and I was like, I didn't book this week. I even have I have Black Friday. I have that actually booked, and I missed today.
That's fine. It's always a privilege again to catch up with you, and
to be honest, people don't think I'm busy because I show up in sweatshirts a lot, but there's an awful lot going on in my life right now. So I'm glad to have the podcast booked through the end of the year, and I'm starting to book some really fun people in January, February.
You got some ballers on there, like I said. I mean, it's impressive. Some great content on there. So I was early doors when you were scratching around for people, and now I've come further up the list. I'm like, wow, I'm privileged. This is great.
Yeah, I mean, people don't know how this sort of transpired. Was it just conversations with people, and they're like, oh, and I said, I would like to really record these conversations, and people like you would be like, yeah, you should do that, absolutely. And then I just turn around and go, if you're on the show, I will do the show. And enough of you said yes, and and I'm looking forward to it. I finally got Darren Dworkin from Cedars. He's going to come on.
Awesome.
And it took a little while to get him, and then just a whole host of people have said yes, and I just need to follow up. So I'm looking forward to some really fun conversations, even through the next couple of weeks and then into next year. But we'll definitely have to keep doing this, because next time we'll do it at a bar where you're sort of dressed like this.
There you go, and I'm much more comfortable in a bar. You'll get a way more fun interview out of me anyway, right? As you know. So
as I do know.
I appreciate it. Congrats on the folks you've had on there. There's definitely some giants of the industry. So, and if anyone's listening and watching, haven't been on there, that are upstanding in their community, get on there. And this is about paying it forward, right?
It is about paying it forward. That's what the show's tagline is, for the next generation of healthcare leaders. And I thought, if I had this resource when I was a CIO, I would have just listened to it, looked for the videos, and I would have just sent them to my staff all the time. I mean, to have John Halamka talk about blockchain, and Chad Brisendine's one of the smart. He's in that young category with you. I think he just turned 40.
I did a couple of months ago.
Okay, yeah. So you guys are both in that exact same.
Is that considered young still?
For getting to the CIO role, 40s. Yeah, I think that's you've accomplished something to get to a CIO role by 40.
I just skate by my accent, but it's good. I'm
yeah,
happy.
People just assume that British accent makes you smart. So I would have just been picking up that material, sending it out. I would have, if I listened to, there's just so much great content, and people are like, they just appreciate me bringing.
All right, it's like a quick education in certain areas. I was saying, I referenced some of the material, some of my favorite material, and it's a short blog post, but so relevant. I did I should really say this was mine and you stole it, but no, it was. By
all means, take whatever.
That's what I do say.
Yeah.
But it's
planes, trains, and automobiles.
Planes, trains, and automobiles. Right. So it's keep the trains running, build new track, and then build airplanes. And it's so true. And if you haven't, I don't know what that was early on blog post, but I would say there's nuggets in there because it's so true. Check that out.
I think in 3 weeks we're having Arch Collaborative on, and that's something it's because they went through and interviewed all the not all, like 180 implementations of EHRs to good, bad, or indifferent, and then identified the 7 or 8 things that were common across the successful implementations, and probably something to
love that stuff.
Yeah, to get ahead of, and I'm really looking forward to that conversation. Some people had come on. Lee Milligan had come on. Amy Maneker had come on and alluded to it, and the gentleman from class agreed to come on and just talk about the research. And
that's great
stuff. So I think that'll be good.
It's nuggets, right? It's like life hacking. Like my man Tim Ferriss, who I love very much.
And I make the 3-minute videos just for people like you. In fact, the thank you gift for people who've been on the show is a book. I just sent you a book. I don't know why I sent you a book. You hate these really thick books.
What sort of book is it?
It's
is there pictures in it?
Are there pictures in it? No, it's the Leaders, Myth, and Reality. It's General Stanley McChrystal's.
No, that's good. I've always got books. I like the tactile feel of paper, but it's annoying carrying it around. So there's nothing better than the Kindle.
Yeah. When
you're just flipping out, it's convenient. But I'm always book a month is my target. How many books do you read?
I don't finish many books. I talked to a publisher once. This is really just us rambling. This is what the show is.
But this is good. I think
this is what the show was meant to be, actually, oddly enough. But I met with a publisher once, and he said what they try to do, because they know most people don't finish books, especially business books, they will take the meat of the content and try to shove it into the first 3 or 4 chapters. And so I have found that to be really true, that like I get to like the 5th, 6th chapter and I start to get bored of the material.
Right.
And I suck as much out of the first couple of chapters as I can. Plus I listen to a bunch of books while I'm exercising. So clearly I'm not listening to that many books.
Exercise more. Audible is awesome for that. I like to listen in the car, right? The education machine, otherwise known as the car. I'm always on calls or listening to podcasts and Audible. Okay, so number 1 podcast outside of your own.
Wow. Andy Stanley's podcast on leadership is exceptional.
Really?
Yeah.
All right.
It really is exceptional. There's another one I started listening to, which is Story Brand. I can't remember the guy's name, but he wrote a book. It's by the same title, Story Brand. And what he talks about is that when you're building out a vision or those kind of things, it's just like writing a story. There's an event or something. There's a villain. There's a guide. And he talks about that whole aspect of it. In fact, that's part of the chapter I wrote for Ed Marx's new book, which the editors have not cut out yet. So
really,
yeah.
What's Ed got a book coming out on?
That book should be out. I think it's coming out for HIMSS, so it'll go to print in early January. It'll be published at HIMSS.
Ed's a champ. He's got a good. He was a speaker at the what did I do? CIO boot camp over in Chicago booth.
Oh yeah, he does the boot camps. Actually, the lineup for the boot camps now is just exceptional. I mean, it is. Tim has done a great job bringing in. Jonathan Manis was there. Ed Marx was there this past week. Sarah Richardson was there. I mean, if you haven't done the boot camps, it's worth doing. I sent you there, Jim.
I did Seth, a couple, both of those.
Yeah,
really good.
They are. Yeah, if you haven't sent your staff to those are worth doing.
Yeah, good tools as well, right? In terms of that progression, is thinking about managing up. What does an executive team really need to see? Because as technologists, we get a little deep.
But all of my guys said the same thing. The test was a little wonky.
The test at the end.
Yeah, there's a certified CIO whatever was a little wonky. Had spider diagrams.
Oh yeah, I think I failed.
Goofy stuff like that. I don't. Well,
good content.
People ask me, like, "What? Are you a certified CIO?" I'm like, "No, I was an actual CIO, but I wasn't.
You are certified as well.
I'm certified. I'm certified on goofy things that don't matter anymore.
Certified insane,
like Citrix and VMware. People.
All right, Bill. As now this is the David Baker Show. One more question for you.
You should do more. I should have you as a guest.
Let me co-host one. Let me stick a couple in it, because I don't have the discipline to keep putting these on. I got like a profile bio thing I stuck up, and it's got blog coming soon, because I'm just not good at following through on
How
the
can you
consistency.
possibly do this job, an Epic implementation?
I know, there's a lot going on.
If you happen to like be in a bar with somebody and want to do a show, let me know.
Okay, I will. If you ever find someone interested, I know a few good people. Okay, so let's just say
I did see a picture of you and Benioff together. If you can get Benioff on the show, then by all means.
You want me to? He's on speed dial.
I'm sure he is.
Me and Mark were like,
what was your question? Now you're just bragging.
No, I'm not. I'm joking. I wish. What was my question? Oh yeah. Okay. 5. The 5's a busy freeway, right?
Yes.
Okay. If you could put anything you wanted to on a billboard on the 5, just for the hoot, what would you put on that billboard?
Just for what?
Just for the hoots, just for giggles. What would you put up there? What message would you like to send to the millions of commuters driving past the busiest point of the 5 every day?
Gosh.
You better not cut this.
Yeah, that's tough. I love, you have to really think through that, because Aaron Levy, who's the CEO of Box, at one point put this really funny, he used to really poke fun at Microsoft. So he used to put this really funny stuff up about Microsoft, making fun of Microsoft on like highways in San Francisco.
Really?
Yeah. And, so you fast forward about 3 or 4 years later, and he's trying to partner with Microsoft. And you're like, you just never know what your future is going to look like. So you have to really
don't burn your bridges, right? Yeah, he's like, hey, about that SkyDrive thing, which is now OneDrive, right?
OneDrive, yeah.
We've got an idea with this box being integrated. Can you help us? It worked out. They're integrated.
Yeah, I would take just one of those quotes from, we see them every now and then pop up on LinkedIn that just reminds people to, invest their life, give back, serve. It's crazy. The wealthiest people that have the best disposition are those that give a lot, that do philanthropy. And we don't think that way. We think, they're happy because they have the money.
Yeah.
I think they're happy because they're giving the money. And it's people that give back. It's people that give back to the community. It's people who give back. And so I don't know whose quote I would use. It wouldn't be one of mine.
It should be.
I don't know if there is a original quote from me, but it would be something to the extent of, see the need around you and meet it. Just see the needs of the people and start meeting it. So I don't know what it would be. I don't know what the quote would be.
When's the last time you gave back? Question mark.
I don't know.
Bill Russell.
You know what I have learned? Because one of the things I brought into our IT organization when I came in was the fact that we are not graphic designers. So I actually put a graphic design budget together, and we hired graphic designers to really help us.
Really good.
And all of a sudden people were like, yeah, I really understand now what IT is trying. We were just bad communicators.
Terrible.
And we hired, I actually had a professor, head of a department for one of the universities on speed dial, and he would read our text and stuff, and he would help us to communicate better. And we had graphic designers, we had videographers.
We had an engagement team for projects.
You created a couple videos.
That's my secret sauce. Yeah. No, the engagement team was was really cool, because it was like this buffer, right, between, if you stick sometimes a really technical person in front of your user, and it's just like they're speaking a different language, and then people get annoyed with the IT not understanding. So put a human in between that actually is.
I'll tell you the other thing I love about this is you get those sound bites, and the person who is most impressive to me on sound bites is Rod Hochman, CEO for Providence.
Oh.
And we sort of joked at one point after Providence came in and we merged with St. Joe's, we sort of joked because I asked his team, I'm like, what do I need to know about Rod? And they said, Rod speaks in sound bites. So I asked Rod about it, and Rod essentially said, yeah, he goes, you know why? He goes, because you have to be clear about communication. He said, so if I'm going to talk about what we're doing in this area, it's these 3 points. Because you know what? I'm going to have to say it like 1,000 times to 1,000 different groups.
Right.
And I want to make sure I'm communicating the same thing. Because if he wavers and it gets goofy, by the time you get to the 5th, 6th, 7th group, they're not thinking the same thing that the first group's thinking.
Right.
And so he sits back at some point during the year. He'll sit back and he'll go through his things to say what's the most important thing to say about our mission. What's the most important thing to say about? And he will just get those down, because as a leader, especially a leader of a 20 something billion dollar
22
organization,
billion, I think, right? Yeah,
100,000 some odd people. I mean, you're communicating to a lot of people. It's almost like a presidential election. You have to drive home your talking points so people can act on them.
So was he on there? Was it
Rod was on the podcast, yeah.
Okay.
And I mean, my little joke on that was, Rod was on the podcast. He did it from the St. Joe's office, and the sound was really bad. I'm sure because the network was struggling. So
no comment.
No comment. I'll cut that. No, we had a great network, but for some reason we had a bad some bad audio during that time frame. So it is what it is. You never know what laptop you're on or what's going on there.
Never know.
So thank you again for being on the show. Appreciate it. And look forward to hearing about your implementation. I guess we'll talk to you after you're done your implementation. So
we'll know before that.
What's that, like 3 years from now? Or
no, you don't 3 months. No, we'll be quick. Then I guess. But no, we'll circle back. Let's circle back in a year at a bar.
Absolutely. And if you want to host somebody, just let me know.
I will do.
And that's all for this week. And please follow the show at thisweekinhealthit.com. Follow me at the Patient CIO on Twitter, and follow the show at This Week in HIT. And you're not writing much these days, but how do people follow you?
Writer's block I got going on. No, LinkedIn.
Yeah,
I'm under that as I think just straight up David Baker. You just search, and then I have a bio page, techieexec.com as well, and that's the handle on Twitter as well. But I'm not really tweeting too much. There's a lot of tweetings. I'm not one of them.
Yes, I tried to do 2 tweets a day when I was the CIO.
Yeah,
yes.
I do try, but.
And you could tell on the days I did the 2 tweets, it meant I did exercise, and on the days I didn't, it means I didn't exercise. Because once the day gets going, there's no way to do it.
I'm really into LinkedIn right now. I find it's quite a good spot.
I do as well. So thanks a lot for being on.